Acyanotic congenital heart diseases, CHD, are congenital heart defects where oxygenated blood circulates normally, so there is no cyanosis. These defects usually involve abnormal blood flow patterns, often leading to increased blood flow to the lungs and causing symptoms such as heart murmurs, breathlessness, or heart failure. Here are the main types of acyanotic congenital heart diseases. 1. Ventricular septal defect, VSD, is a hole in the ventricular septum, the wall separating the left and right ventricles, allowing oxygen-rich blood from the left ventricle to mix with oxygen-poor blood in the right ventricle. This leads to increased blood flow to the lungs, potential heart failure, and pulmonary hypertension if left untreated. 2. Atrial septal defect, ASD, is a hole in the septum that separates the left and right atria, leading to a left-to-right shunt where oxygenated blood flows from the left atrium into the right atrium. This can cause right atrial and ventricular enlargement, potential arrhythmias, and pulmonary hypertension. 3. Patent ductus arteriosus, PDA, occurs when the ductus arteriosus, a normal fetal blood vessel that connects the pulmonary artery to the aorta, fails to close after birth, leading to abnormal blood flow from the aorta to the pulmonary artery. This results in increased blood flow to the lungs, heart murmur, heart failure, and pulmonary hypertension. 4. Coarctation of the aorta is a narrowing of the aorta, typically near the ductus arteriosus, which obstructs blood flow from the heart to the lower body. This can lead to hypertension in the upper body, reduced blood flow to the lower body, potential heart failure, and risk of aortic rupture or dissection. 5. Pulmonary stenosis is the narrowing of the pulmonary valve or artery, which obstructs blood flow from the right ventricle to the lungs. This can cause right ventricular hypertrophy, heart murmur, and potential right heart failure. 6. Aortic stenosis is the narrowing of the aortic valve, which restricts blood flow from the left ventricle to the aorta and the rest of the body. This can lead to left ventricular hypertrophy, reduced cardiac output, and potential heart failure. 7. Atrioventricular septal defect, AVSD, involves a combination of an ASD and a VSD, along with malformation of the atrioventricular valves. This results in mixed oxygenated and deoxygenated blood flow, heart failure, and pulmonary hypertension. 8. Mitral valve prolapse occurs when the mitral valve leaflets prolapse into the left atrium during systole, sometimes leading to mitral regurgitation. This can be asymptomatic but may lead to mitral regurgitation, arrhythmias, and, in severe cases, heart failure. 9. Congenital aortic arch anomalies include anomalies such as a double aortic arch or right aortic arch that can create vascular rings compressing the trachea and esophagus. This can lead to respiratory distress, difficulty swallowing, and feeding issues. 10. Ebstein's anomaly is a rare defect in which the tricuspid valve is abnormally formed and positioned, leading to tricuspid regurgitation and an enlarged right atrium. This can cause cyanosis if significant mixing occurs, along with arrhythmias and heart failure. 11. Congenital heart block results from abnormal development of the heart's electrical system, leading to a heart block where electrical signals are delayed or blocked as they travel from the atria to the ventricles. This can cause bradycardia, fatigue, dizziness, and heart failure. These acyanotic congenital heart diseases, while not typically causing cyanosis, can still lead to significant health issues if not managed appropriately. The management strategies vary depending on the severity and specific type of defect, but often involve medical management, surgical correction, or catheter-based interventions to prevent complications like heart failure, pulmonary hypertension, and arrhythmias.